Yes. Tell me, any difficulties?
So we just wanted to know the formats for major and minor practical.
Okay. Uh, what I can suggest you is, since you have not done any practical, isn't it?
Yes, sir.
So these are the practicals, isn't it? Can you see?
Yes, sir.
Can you see?
Yes. Yes, sir. It's visible.
Okay. So answering drug information questions, patient medication counseling, case studies related to laboratory investigations, and I think you have told me that you people have done some of the cases related to that. Laboratory functions, liver function test, kidney function test, I suppose, isn't it?
So we have just studied the theory part of it, but we have to study the case studies related to that topic.
Okay, 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 fine. Then patient medication history interview. Okay. Now, what I'll suggest you is the best thing is these are the 15. It has been put like that. So you can submit it as an assignment. Okay. Instead,
Okay, sir.
instead I give you something and you write something. Maybe you are not knowing about it. You can put that assignment. You can make it as assignment. Okay. And you divide among yourself. That is, these 15 are there. How many students are there? You are I think
So 26.
26 are there. Almost you make this list in this way, 4 4 4, go on repeating like this, isn't it? That is A B C D, again A B C D, again A B C D, or whatsoever sequence you make. Okay. So you make this sequence, go on repeating, and till 26 whatsoever the person will get, you can make the assignment on that. Whatsoever good information you are having, whatsoever best you can write about it. This can be done.
Okay, sir.
This can be done.
Yes. Yes, sir.
This is, I think, easy. I think it should relieve you.
Yes, sir. Yes, sir.
Okay. And then another is synopsis part. Then whatsoever theory has been taught, I am collecting the information about it. And whatsoever has been taught in theory, on the basis of that we can have a synopsis, because usually synopsis is based on theory in any kind of examination.
Okay, sir.
Okay. So since yesterday I told that you don't worry about it, you can have you can go on reading about your theory, so that you can answer synopsis well. And about this actually I discuss, and then this is what the best solution I find, that you can do it, so that it won't give you stress. It will be easy for you, and it won't affect your performances, because your major performances will be on the basis of your theory and synopsis.
Okay, sir.
Any difficulty? Anyone is having any question? I think we should try to close it at earliest, because you have to study and I have to prepare for your examination. Okay. So
Okay, fine.
if anybody is having any query, any difficulty, let us address it now, so that by chance later somebody should not feel that no, I had some this and I could not do this. Yes, fast. Those who want, they can do fast, or simultaneously they can put it on chat box. Simultaneously I can answer them. Okay. I open chat box. So do it fast, so that we can close the meeting at earliest. At the same time, I don't want that some difficulty has remained unanswered. I think should I give 3 minutes from
सर
this?
सर असाइनमेंट हे कधी सबमिट करायचं म्हणजे
एक्झाम झाल्यानंतर लगेच. एक्झाम झाल्यानंतर दुसरी लिंक येईल तुम्हाला. 2 लिंक येतील. एक सिनॉप्सिसची येईल, आणि दुसरी लिंक जी येईल ती असाइनमेंट सबमिशन करायची. एक्झाम झाली, आधी सिनॉप्सिस द्यायचं. सिनॉप्सिस झाल्यानंतर तुम्हाला वेळ दिला जाईल 2-3 तासाचा. तेवढ्या वेळात तुम्हाला सर्च करून ती असाइनमेंट बनवता येते.
ओके
सर सिक्वेन्स काय राहील असाइनमेंटचा एबीसीडी टाईप करायचं आहे का
करा ना
रोल
तुम्ही,
नंबर
तो डिसाईड करा. तुम्हाला सगळ्यात सोपं तेच होईल की ABCD रोल नंबरच्या समोर ABCD करा, आणि जे रोल नंबर आहेत, हजर आहेत, त्यांना तसं देऊन टाका.
सर सिनॉप्सिसला किती मार्क्स आहेत
मी तर 30-30चा पॅटर्न ठरवला होता, कदाचित आपण 40पर्यंत जाऊ सिनॉप्सिसला, है ना.
ओके सर. हो सर.
हां.
Sir, what do we write in those assignments exactly?
हाऊ द क्वेश्चन्स आर देअर. तुम्ही थिअरीमध्ये काही शिकलायत का याच्या बाबतीत मिलिंद? ड्रग इन्फॉर्मेशन क्वेश्चन्स.
Sir, in general, we have studies like what are the steps, what is the aim of drug information queries, like that, sir.
Okay, no, questions are there, suppose how they are answered, basically. Okay,
Sir, we haven't.
No, sir.
you can search it now, don't worry, it is not there. Then patient medical medication means, suppose information queries are there, you can expect that what patient will ask you, and accordingly what queries you can have. Okay, it can ask about a specific drug, what is the utility, what can be the adverse reactions, how the person can prevent adverse reaction of particular any specific drug. Okay, suppose or what should be on the basis of example, let us take tuberculosis drugs. Okay, now tuberculosis drug, everybody is knowing that what are the things, what the question it can patient can have, what question the doctor can have. Hello, hi Milind.
Sir, so we have to keep it in general terms. We don't have to take a particular case and discuss the following question and all.
Anyway you do, because now I will not make that very rigid one. I'll make it open, Milind.
Okay, sir.
I will not make it as a rigid that because I want this only, I want this only. I am suggesting this. Since you ask me that how it should be there, basically how it is there, drug information questions can ask by anybody. It can be asked by a layman who is not taking any treatment, but just curiosity has asked. The other thing can be the relatives of the patient can ask. Third one, patient himself can ask. The fellow pharmacist can ask, because if you are expert pharmacist, more expert pharmacist, and there are so many small medical pharmacists are there, they can ask. Then it is even expected that the doctors, medical practitioners can ask if the drug is new or something new information is there, or maybe they are missing something. So basically there are so many people are there who want to seek drug information from you. Now for that your way will be different. When it is medical practice, there are many sites actually, if you will see, there are many drug information sites are there, even like RX list or related to Medscape, etc. At many places you will find that who is the user. They ask you who are you. If you are you say that I am a pharmacist or I am a medical practitioner, then you will get more technical information. Okay, so that is in very technical language and very appropriate one. And when it is a layman question or the patient question, then it goes in that way. So this is what the skill is there related to answering drug information queries. Similarly, medication counseling, the patient will have questions, and when it is given, when it is administered, then what kind of counseling you are supposed to do. There are many things which are there with the counseling, how to take, with to take. If you know about medication related problem or medication errors, we call them that they are because of many things. So we call it is because of the wrong diagnosis, then it can be because of the wrong drug chosen, it can be because of the wrong directions, and lastly it can be because of the this wrong direction you can omit, you can avoid when this counseling you are doing. You can ensure that how the patient is use it best way. A few years back, I think last year, the students, 5th year student working under me, they did one project that was related to inhaler use, and they had a questionnaire. On that basis they assessed that many people, they do not know how to use these inhalers, and because of that the drug is not appropriately reaching to their body. Okay, so they then devised this, they started counseling, they started training, and on that basis they again took the questionnaire that now how you are using the inhaler. So this is what output of the this one counseling, that is, you see that what is the best direction that is being followed by that, to what we call as a patient compliance. So how you improve, that is the basic job, basic role of counseling. Then related to laboratory investigation, you can find several cases. There is no dearth of that cases. There are so many cases having either liver problem. Again, you have studied everything in JIT, you know about it. Okay, in therapeutics you have studied. There are so many example hepatic diseases. It can be alcoholic cirrhosis, it can be hepatitis, it can be any kind of drug induced liver disease. You know, then whenever there you have studied all this, you know the theoretical aspects of it, that these are the conditions, and you have even seen the differential diagnostic test, if you remember, in that is alkaline phosphatase, etc. Which kind of hepatitis, in case it is increasing, decreasing. Okay, we have seen jaundice types. So these are all actually you have studied them. Then patient medication history interview, how you will taking without affecting the patient. I think there are theoretical topics about it. Have you done it? Open-ended question, close-ended question, etc.
No, sir.
Direct questions, indirect questions.
No, sir.
Okay, okay, let it be. So this you can learn, then basically it will help you, because maybe in fifth again you can use this basic knowledge when you are going in 5th year and 6th year. It is expected that you should use it, and if you take interest in that, definitely it will help you a lot, because if you see it in the aspect that it is examination and getting stress, marks may be, you know, few marks, somebody may get more, somebody get few marks less. That is not a big issue. The big issue can be what knowledge you are gaining, and that is very important, and that how you can utilize it. Basically, when we say it is a professional education, it is based on how professional knowledge you get. So when you study it properly, when you learn it, you go through it, there are so many aspects of it, and don't get tense about it. Okay, be very calm. You just prepare it, and everything you concentrate on, because anyways theoretical topics are nicely taught, I suppose. So there should not be any problem, because we are keeping okay, we are keeping synopsis, and synopsis 40 mark component is quite a good component, so you should not have difficulty out of it. any
असाइनमेंट तुम्ही मेजर एक्सपेरिमेंट राहणार आहे का?
फक्त मेजरच ठेवणार आहेत आपण.
ओके.
अजून
So in C point, do we have to present the case in the SOAP format, the case studies related to lab
no,
investigation?
here it won't be possible to make it in SOAP format. SOAP format is in therapeutics, because in SOAP what it is subjective data. Now here you won't get much subjective data, then objective data, then assessment. Okay, so here this criteria you will not meet, because here basically is a theoretical thing. Okay, and theoretical thing which has to be practiced in that way. Suppose drug information questions, so how you will get any subjective data, how you will get any objective data. Okay, how you will give assessment and plan, because here no accordingly. Instead, what type of questions are there, you should you can get, and what kind of answer you will write. That is very important. What kind of questions you will get, and that, suppose what sort of questions you are getting, if you do not know, then from where you will be answering it. What should be the appropriateness of drug information cases, what should be the appropriateness of your patient counseling. I'll just cite one very important example. In very first time when I went to hospital, and that time the HOD Bhattacharya madam, who is presently HOD, she has recently joined over there, she has taken over charge as, and she was very skeptical that what will be happening, because she told me that what your patient will be doing counseling, and if they do any wrong counseling, then who will be responsible. Then it struck in my mind that it's true. Suppose you are not that well equipped, because this is the patient. If you are, I don't know you are aware or not, but I have seen the examples long back, in somewhere in 2000 or just around year 2000, there was a plague epidemic in Surat. And then just like WhatsApp media at that time, whatsoever media was available, including newspaper, etc., etc. So that media started that tetracycline is a very good drug, and most of the doctors who are in small villages and other places, They have done either Ayurvedic courses or homeopathic courses, but they practice allopathy. They started prescribing tetracycline and tetracycline because now it was open to all. It was open information that tetracycline is effective in plague, and they started writing direction that or orally giving direction that इसको दूध के साथ लो क्योंकि गर्म पड़ता है. इफ यू माइट हैव सीन इट, अगर किसी डॉक्टर के साथ वो ले लैंग्वेज में जब बात करते, दिस इज हाउ डॉक्टर्स आर काउंसिलिंग. But now if it is a good pharmacist, he knows that tetracycline should not be given with milk or food because it causes impact, absorption impact, because it gets chelated. तो ये चीज़ें हैं जो अच्छा नॉलेज वाला है. सो दिस इज़ हाउ काउंसलिंग इज़ इम्पॉर्टेंट. ओके, तो उसने टेट्रासाइक्लिन उसका यूज़ ही नहीं होगा कोई भी, क्योंकि टेट्रासाइक्लिन दूध के साथ लेगा तो दूध के साथ पूरा टेट्रासाइक्लिन चिलेट होकर वो जीआईटी से बाहर निकल जाएगा. So these are very very important counseling aspects, so that you can allay the fear. You can see that how the best use of medication is being done, how you improve the compliance of the medication. These are all things which are very very important. So don't you can go through it. Case related to laboratory investigation, you have already studied it many a times. You have studied it in pathophysiology. You have studied it in all the therapeutic classes. What are various laboratory investigation done for one or other kind of cases? Example, atherosclerosis, what you do. If it is hepatitis, what you do. If it is kidney, what you do. Already in all cases, and pathophysiology and therapeutic diagnostic condition, you have studied all them. So I don't think you should have any difficulty in that. And the patient medication history introduced, but I'll suggest again that try to concentrate on the topics which you have not studied or you have not learned. It will give you interest. Maybe what will happen is, somebody has done it nicely, may get 3, 4, 4 or whatsoever, maybe 5-10% extra, somebody may be having 5-10% less. Okay, but at least that will improve your knowledge, that will help you, and it will make you happy that at least you have learned about it. So don't worry about it. You should not be tense. You give examination with good comfort. Okay, any difficulty?
No, sir.
So I think I have removed all your fears.
Yes, sir.
Huh? So you will concentrate now on your examination,
Yes, sir.
isn't it? So don't worry. I am very sure you have, yesterday only I have given message that at least synopsis you prepare from theory. I am sure you have prepared it from theory. Okay, and after theory till synopsis you can prepare for theory. Okay, because after synopsis I am giving you around 2.5 hours. You can do it nicely after reading. You should not have problem.
Okay, sir.
Okay, I hope your fears have gone.
Yes, sir.
Okay, so should we close?
Yes, sir. We can close now.
Okay, okay then, all the best.